This is an interesting patient with proliferative diabetic retinopathy and localized tractional retinal detachments in his right eye. When he first presented in about April, you can see the areas of neovascularization or abnormal blood vessel growth throughout the retina that are extending from the optic nerve and creating tractional retinal detachments where the retina is actually being pulled off of the wall of the eye due to the scar tissue and the abnormal blood vessels that have developed. His angiogram showed some neovascularization as well as non-perfusion or poor blood flow due to the extensive disease. His left eye is in much better shape, but still also has some neovascularization. I decided to treat with PRP laser to provide some long-term stabilization and to also hopefully protect the macula and prevent these tractional detachments from progressing to involve the macula and then affect his central vision. And when he returned, you can see all these little black scars are the intentional scars from the laser, but also notice all this extensive abnormal blood vessel growth extending from the optic nerve and contributing to these localized detachments of the retina. But notice how much that improves after just one injection of Avastin, which was between here, which was actually today, and the visit prior, which is this photo here. So all that unhealthy abnormal blood vessel growth really has just disappeared and melted away, but it's resulted in some persistent scar tissue that's contracting and doing its darndest to try and detach the retina. So this is an interesting case of a patient that was treated with PRP laser to help provide some long-term stabilization of the proliferative diabetic retinopathy, and also that shows the benefit of the Avastin that helps get rid of some of the abnormal blood vessel growth. Multiple ways to approach this patient moving forward, but this is just a nice example of a patient with proliferative diabetic retinopathy and tractional retinal detachments. And I appreciate your interest. Thanks for watching.